Hello, I'm Ryan Macasero, Cebu Bureau reporter for Rappler.com. Cebu City is entering its first week into general community quarantine, and joining us today is Cebu City Councilor Joel Garganera, who is the czar for the Emergency Operations Center for COVID response here in Cebu City. Councilor, daghan kig salamat para sa pag-accept sa among imbitasyon karong adlaw.
Yeah,
So,
it's my pleasure.
So we'll just get into the first question right away, no? After nearly mga 4 or 5 months of lockdown, we're starting our general community quarantine. So asa naman ta karon isip syudad in the context of ang COVID response?
When we do another lockdown, no, that was July 1st. Yeah, that was it. No, ano?
Mm.
Yeah, around that time. Right now, everything is doing in a good direction. No?
Mm.
Our COVID positive starts to decrease from
Mm.
digit figure. Now it's degrees at digit figure, and then our positivity rate is really from 32, 29, 16, 11.
Mm.
Yesterday, the other day was 6. Now it's 7.4. So deaths are also decreasing. So it seems like everything is working already. No?
Mm.
And then my fear is when we downgrade again to another status, quarantine status. Well, WHO has a figure for this that all LGUs downgraded. You could see a rise within a week or two. So that's just my fear. But
Mm.
everything we're very much ready to address that issue.
Mm. Since we've been through this before, naka GCQ naman tayo og diha man nag-spike ang ato ang numbers. Can you explain a little bit what's our plan to try to prevent that from happening again now that GCQ na sad ta?
Yeah, before we used to have only like five contact tracing teams,
Mm.
and but right now we have around 114 contact
Mm.
tracing teams, and then we have a separate swabbing team. No? And on top of that, we really get the support. No, got the support of the barangays because they're on top in making a lockdown on houses that have positive individuals,
Mm.
and then they also extract the patients and they transport it to an isolation center. And
Mm.
not only that, we have 4 clustered clinics spread out in the city. And
Mm.
to those who manifest symptoms, based on the assessment of the doctors there, they will
Mm.
be swabbed. And then when they are swabbed, once they get when they return to their dwellings, their house will be locked down, but they will be they will be informed about the procedure, and then there will be intervention, and that is contact tracing and swabbing. And if the waiting for the result, of course the city will be providing provisions for the
Mm.
duration of the lockdown.
Mm.
And then once the result will be negative, then it will be lifted. But if not, then the same procedure. And we have also this called granular lockdown. It is not the
Mm.
entire barangay or the entire city locked down, but it
Ah,
is a way also of trying also to help our economy, that we don't have to lock down everything here where the
right.
positive are situated. So the police and the medical doctors, they have a way of doing it, no, and that
Mm.
those that are not affected will not be included in that.
Counselor, because I just wanted to understand a little better um, what we did wrong, I guess, in the past to have I guess the attention of the national government, diba? Or what we were doing what were we not doing then that we're doing now? How did we end
Actually,
up becoming, one of the what they called another epicenter of
epicenter.
COVID? Yes.
Yeah, actually, before I am very convinced that we are very much ready.
Mm.
We have isolation centers in the first level. That's the barangay isolation center intended for symptomatic patients. We have the second level, which the city put up. We have the Cebu City Quarantine Center, CCQC. you have also the Bayanihan and then IEC. And then at the time, our hospitals were really, ready to receive COVID patients at the time. We are not overwhelmed. But then again, uh, we have a system. I was convinced with that, but then again, we never anticipated that the frontliners, uh, was able to get the virus also. No,
Mm,
I remember one time when our quick response team, more than half of them got the virus, and there
mm,
were nights wherein there are no response, there are no drivers for ambulance. In fact, we have to
mm,
force a driver who is positive by COVID positive. Anyway, he's transporting a patient that is also COVID positive. No? And then there was also one time when more than half of our operators got the virus. They were exposed. Me, for one,
mm,
I got the virus. I was isolated for 35 days. And starting from there, everything just, we're so overwhelmed. There was a spike. And then there was the transition from MEC, ECQ at the time to GCQ. So people just went out of the streets. And that was the really the worst part was in mid of June,
mm,
wherein we are so overwhelmed. We're so overwhelmed. We're the epicenter already because we were not able to make a secondary line of frontliners. So
mm.
it was more on the human resource that we failed because most of us got the virus.
So would you say there was an underestimation of how viral this disease really is?
Yeah, yeah. Because the virus is also evolving. No,
Yeah.
so we were not able to anticipate it. No, and then really there's no manual for it. There's no manual for it. And then we keep on validating everything we do. And then but during that time I was also not around there during that time because I was in isolation.
Mm,
Really, really get worse until such time where we got to have a fresh eye from Manila in the person of course, General Simato and General Feliciano.
mm.
And everything seems to be on the right direction then.
How is the local government's relationship with Simato, who's helping oversee the COVID response, and General Feliciano?
Yeah, very good, very good. I would say, I have to correct that misconception that they're taking over. No, 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 it's not. They're trying to help us. They're
Mm,
trying to provide us a fresh eye on the situation. Because I, for one, setting biases aside, I really believe that our system was really good. I mean, it
mm,
worked before, so there's no reason why it will not work now. But as I said, no, the virus is also evolving, no, and then when we got to hear their inputs, and then once you're inside the picture frame, you cannot see the entire frame. While them outside looking at us, they were able to see the defect, what needs to be improved. So that was something, wherein for the first time, all the parts in the system got to work with each other. Because before, just
mm,
like per cluster, okay, just do your part, just do your part, just do your part. But then again, they don't know what the other is doing. No, they
mm.
don't know what the other, and they don't even are concerned, on what the other is doing. And then we should realize that everything needs to be synchronized. No,
Mm.
and one thing, the other needs the other thing. No, so
Uh,
so that it keeps the system work.
yeah. So I just have to bring this up. I hope I don't know if you have an answer for it, but some of the critics have said that President Duterte sending Simato and Feliciano here showed a loss of confidence in the local government ability to handle the crisis. Do you disagree or disagree with that, and why?
Actually, we really dropped the ball there. No,
Okay.
as I said, that's the reason we really dropped the ball, and then aggravated by the fact when uh, when it downgraded to a lower quarantine status. So people just went out. That's when the president said, "Gahig ulo," no, because
Mm,
they can see all the pictures there as if nothing happened. No,
mm,
but the local governments are in Cebu City, for one, no. we stood up, and then we tried to correct everything, all over again, and with the
Okay.
help and aid, of course, of our IATF overseer.
In your working relationship with them so far, what are the like biggest takeaways you got from the national IATF who've been here very hands-on in Cebu?
General Feliciano is very meticulous into details. Like, the biggest problem we have is how to trace those line lists, those positive line lists. And
Mm.
then, because once it reached the barangay, sometimes the address is just the name of the barangay. When you talk about Guadalupe and you just put there Guadalupe, Guadalupe has a
It's big,
60,000
yes.
population, no?
Mm.
Mabolo has a 40,000 population. So that is where, to me, that's the root of the problem, and how to locate a particular individual who is positive with COVID. And
Mm.
sometimes there was some mis, like Guadalupe. There's also a Guadalupe in the province, no? Like
Mm.
Banilad, it's not Banilad Cebu. There's Banilad in Mandaue.
Madami.
So 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 the general, he's not. He meet with all the General Feliciano, meet with all the hospital administrator. He meet with the laboratory head, and then he told them about the problem. Only contented with that, he again meet with all those who are in charge in transmitting the information. And he told them that really you have to transmit the correct address, the correct name. If as much as possible, you put up the numbers there. So every cluster, he's into that, no? From top to bottom, and then really it was an awakening part on our side, no? We thought we know everything, and then when he tries to connect the other cluster to the relationship, and then it really helped, and he was really on top. And every day we have a meeting at around 8 o'clock. Every day we have our deliverables, and what we're gonna do today and tomorrow. So everything, and every facet of the operation, from contact tracing, swabbing, to extraction, to
Mm.
granular lockdown, to household lockdown, to providing provisions, and LSI as well. So he's really on top of it, and then he really put up a system there, and it really worked.
Mm.
So
Mm.
far, it's good. It's
Yeah.
really worked.
The DOH reported that the hospital occupancy has improved over the past few weeks. So, can you elaborate a bit where we are now in terms of how our medical facilities are coping up with the COVID crisis?
Well, yesterday I received a report that our occupancy rate is around 40, 42%.
42.
No? So that 42%, that includes the private and the government hospital. So that is something, no? We cannot say like 2 months ago or a month ago, no? So right
Mm.
now, in fact, I talk with a lot of doctors, epidemiologists for one, respiratory related doctors. Uh, they're very happy with the turnout of events right now, because in the ground, we're the frontliners. They're no longer the frontliners, because they're the last form of defense. So the barangay is now doing their job in confining the virus, and also the very aggressive contact tracing, swabbing, and then isolation centers are really there to isolate asymptomatic patients, and our
Mm.
clustered clinics, no, are spread all over the city. And then instead of going to the hospital, they went to the cluster clinic, and just got a report this morning. Our ambulance, no, response, really, it really dropped by half the number of emergency cases. No,
Mm. Mm.
so these are good signs, but I cannot afford to be complacent here. I
Correct.
have to be skeptical, because there are a lot of movements right now, because we're slowly opening our economy and everything. So everything's so fragile, so to speak.
Mm.
So uh,
Okay, I just wanted to drill down a little bit more. So, can you explain for our viewers, if I came into contact with someone with COVID or I start showing symptoms, can you walk me through step by step what I should do if for residents of Cebu City?
Like for example, how did you know that you walk with a walk with someone with COVID?
You know, like your neighbor has already been taken away to isolation, and then you know that you talk to them,
Uh,
or you start showing symptoms, influenza-like symptoms,
I see. So it's like
etc.
this. When a person is positive of COVID, we got the line list already. No, the emergency operation center got the line list, and then we that very evening we send our line list to our contact tracers, and the city of Cebu is divided into five groups, and then each group has a set of contact tracers. So the
Okay.
first thing in the morning, and that very evening, they already coordinated with our local uh, barangay BHERTs, and then when they come to the barangay, they are guided, and then they went to the particular house, and then the
Mm.
extraction team are there to extract the patient, but the barangay are there to ahead, and then the need why they need to be extracted. Once they are extracted and transferred to the isolation center, the contact tracer mostly composed of policemen headed by police. These are all these policemen, by the way, are COVID survivors. No,
Mm.
but then when they go to a particular community, they're not wearing uniform, and they're very
Mm.
efficient because they have these cognitive skills in investigation. No? So once
Mm.
they're there, they conduct the contact tracing, and then the vicinity of the household where they reside, and then that includes also that one that has an association already with the person in contact with the virus,
Mm.
and then that particular house will be automatically shut down, locked down, and
Mm.
then city provisions will come through the barangay, and
Mm.
then it will be locked down for 14 days. And after the contact tracing, the following day, there are two cases. It's either the swabbing team, if the area is not really that interior part, because you have to consider also those that are the swabber. We call them the swabbers, no, the swab, because they have to be wearing uh, this PPE, and
Okay.
then if they have to traverse the interior portion. So what we do is we just send a vehicle and ask those that are being contact traced to go to a particular area, most likely the green zone of our barangay isolation center, and there we do the swabbing,
Mm.
and then we return them back to their home, and then wait for the result for another 3 to 4 days. So
Mm.
that is usually the flow on
Mm.
contact tracing.
So, if I'm understanding correctly, it's the city is more taking a more proactive stance in terms of tracing that they would come to you if you had been exposed to a positive person.
And that's one aspect, and the other aspect is because we have a clustered clinic all over the city. What if you feel like you have been in contact with a someone that is COVID positive, and then somehow you feel that you manifest some symptoms,
Symptom.
like so you go to the clustered clinic, and then there's a doctor there, and then if
Mm.
the doctor, upon his assessment that you have the symptoms, then he will swab you right away.
Okay.
He will swab you right away, and then he will coordinate, of course, with the barangay and the contact tracing, because they will also do the contact tracing in your home
Mm.
and the swabbing the following day. So that's
Mm.
that's where we're very aggressive when it comes to that.
If you've been traced by a contact tracer and they swab you, there's no charge to the patient or anything.
No, 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 no.
Okay.
We even provide food provisions.
Okay.
No, if you're a probable is someone that went to the cluster clinic and having swab. And
Okay.
when you went to your house, when you arrived to your house, while waiting for your swab result, your house will be put in a lockdown. So you
Mm.
will be given a provision between 3 to 5 days until the result will come out. But then again, the entire household will be contact traced as well as will be swabbed also.
Okay, thank you for elaborating on that. I
Mm.
wanted to zoom out some more because Cebu has been, under lockdown for a while, except for that short period of GCQ, and then we're seeing Manila returning into MECQ. Um, so I guess the term that the national government used is that we have to learn to dance with this virus or something like that.
Yeah, yeah, yeah.
So locally, how are we going in the long term? Since we have to eventually open up our economy and get business going again. What is our
Mm.
strategy to balance economic activity, restarting the economy, and making sure that people stay healthy?
Well, others would say, like when like last Monday, like, others choose their jobs over their lives, no, because they just went
Mm,
out there, no. But to me, it's hard. Yeah, we don't have the luxury to choose one over the other. These two has to coexist.
mm,
Also, that the virus is here, like we can open up our economy, but this industry or establishment, they have also to be mindful in running their business, that they have to be compliant with the protocols, the medical protocols, not only on their personnel or employees, but to their clients as well. So that is why everything has to be done in gradual,
yeah.
slowly. No, you don't have to operate full. You have to like 30%, 40, 50%, and then to me, the best thing perhaps, because they've been losing their business for the last 3 4 months in trying to really address the issue on compliance. Perhaps the city, and this is one of my proposal, that the city might be able to extend tax rebate for
Mm.
those investments, this technology that they're going to put up in their establishments, so everything can be traced just in case if something happens.
Are you optimistic that we can keep the spread of the virus to, if not completely contain it, at least to manageable levels in the long term?
Well, it can be done. It can be done,
Mm,
actually. We did it in the last like 40 days. We were
mm,
able to confine it. Though, we have a different benchmark. When we have a two-digit positive cases in a day, well, it's different when you talk about Sikihor, and you talk about other places, because to them that's really really big. But to us, coming from a three-digit going to a two-digit, it's something,
yeah.
we can always say that we did something good. We're on the right direction. We're very confident. But, there's, there, we in the government can only do so much,
Mm,
but at the end of the day, the police can only do so much. All the stakeholders can do so much, but it's the entire populace. They should cooperate, because right now everything is focused on Cebu. There are additional police coming over, Bureau of Fire coming over, and there are a lot of stakeholders, trying to help Cebu. And what if other LGUs are also having problems, just like what Metro Manila is doing right now, no? Is happening right now. So we might be sending back our special armed forces there, and then you cannot also help but those that were assigned here from the PNP, they will also be reassigned to other places. So at the end of the day, we have to take care of ourselves. No? We have to take care of ourselves, and we have to really monitor everything. And then not only that, take care of ourselves, but individually, you have to take care of ourselves too. Like as an individual, no, because
mm,
you cannot rely others, because this virus is very scheming.
mm,
They come in the form of a host that could be your wife, could be a member of your family. So
mm,
it's really very hard. So when you take care of yourself, by doing that, you also take care of others.
mm. Lastly, so it's not just Cebu City, but I think all LGUs across the country are also dealing with the LSIs or returning
Yeah,
residents.
yeah.
And Cebu
Mm.
City is a sender, hosts locally stranded people and is receiving also. So can you describe the situation in terms of how Cebu City is managing the stranded individuals right now?
Well, right now, with our Cebu City so far is around 18,000 locally stranded individuals. That's per record.
Mm,
But I heard that there are still a lot of those that are applying for LSI.
Mm.
Uh, they've been stranded here for 4 months already, and then I cannot really fathom what they've been through.
Mhm.
Uh, they need to go back to their hometowns, and right now, just this week, the Philippine National Police for almost 2 months. Uh, for almost 2 months, their operation in issuing the travel authority was suspended. No, and just recently it commenced, and then they are not right now downloading all the travel authorities to the different police stations, and then that will be sent to the different barangays because it should be the barangay that will distribute this travel authority. But then again, there are problems because their LGU where they come from, aside from the travel authority, they ask for other requirements like the health certificate should be updated because those travel authority that were processed like 2 months ago doesn't reflect already the present situation or condition of that LSI. And then other LGU, most LGU right now are also requiring for a letter of coordination or acceptance. No,
Mm.
not because they don't want them to come to return to their place, but they're trying to control the arrival. Like for example, I just received a call from Congressman Matugas of Surigao. They said, can you just send like 300 LSI in a week
Mm.
because they are trying to really monitor and then also secure also their quarantine
Facility.
facilities.
Mhm.
And the same manner also with Ormoc that you have only to send this much per day, and the other LGU as well. In fact, the province of Cebu requires a letter of acceptance on top of the medical clearances, no,
Mm.
the updated medical clearances. So us Cebu, we're not requiring. We just require them to have their travel authority and of course an identification of card. No?
Mm.
So that is in so far as Cebu City is concerned. But except for Manila, because we have to realize that 5 of the first cases that we have here in Cebu City has a history of travel in Manila. That was like 4 months ago. So with the recent case right now in Manila, we might be imposing additional requirements, which is a certificate of clearance or acceptance
Mm.
from the barangay themselves. No, that they have to inspect the house where the place of residence of the LSI. It can qualify for a house quarantine, and they have their own checklist. We just want to monitor them. And by the way, it's been our 5th day already receiving LSI from Cebu City and provinces. Everything is very systematic. We have a staging area in the port, and
Mm.
then all arriving LSI are being monitored. I even asked them to sign an undertaking that they have to do the 14-day quarantine, home
Mm.
quarantine, and then the barangays are very much informed about their arrival. And then I don't know, but it might be radical, but I have to put like an indelible ink for them, no,
Mm.
for them to for them not to go out of their house. No? And once they receive their quarantine undertaking, if they took, we have buses ready for them to all drop-off points all over the city. But if they want to take a cab or anything, and then somebody might try to inspect them, they can always show their quarantine pass
Mm.
undertaking, no, so that they can go to their respective homes.
Do we have an idea how many we're expecting here in Cebu City?
Well, for the last 5 days, there are around 600 arrivals. Very,
Total.
very, very few yet, but there are
Okay.
around almost 1,600 outgoing passengers. Outgoing
Outgoing.
passengers.
Ah.
I talked also with the shipping line, the shipping owners. That was also more or less the same case when we first downgrade to GCQ last June. No, the first week is really few, but then again, way back March, that was not a vacation time. No, children still have their school, so I really don't expect much LSI coming to Cebu as much as those that are here in Cebu and going out.
Last thing, do you have a message for the Cebuanos of residents of Cebu City who've been, going through this crisis for the past 5 or 6 months, and where we're headed into the end of the year.
COVID gonna be here with us for long pagid, no?
Mm.
Uh, well, I'm a COVID survivor, no, and then my wife is a COVID survivor, and four of my staff were COVID survivor. In fact, one of my staff, her father died of COVID. At the back of our house, there were 14 who got COVID. Two died, and my seatmate in the city council, former Congressman Tony Cuenco, succumbed to COVID. To me, COVID has a face, no? And the face is death. No? And right now we are going to 600 deaths in Cebu City alone.
Mm.
No? And the reason why I'm here, not because it's part of my job to be on the front line again, the same manner as with the police and the other, those people there in our emergency operation centers, those frontliners there, those quick responders, those nurses, those operators, uh, all of them, they're our heroes. No, they got COVID and then they return back to work. No, these people deserve not just commendation there, but the second time around, they're doing it not because it's their job. They're doing it because just like what I'm doing right now, because we don't want others to experience what we've been through. No, it's really very hard. And then if we don't cooperate, if we don't act as one, no, we're not gonna defeat this. So we have this opportunity. Everything is on the right direction. I hope people will try to discipline themselves. No, I'm looking at December. I would say COVID will still be here, but somehow we get to know him. You get to know. He also evolved, and then as you said earlier, we have to dance with COVID. No, and then we just have to do our part. These four basic things. No, I will end this by saying that you have to wear your mask. You have to observe social distancing. You have to wash your hands frequent, no? And if possible, if you have no business outside your home, you stay at your home. But this is one thing where I got my COVID. The only time where you lower your guards is when you eat,
Mm.
because you will not be covering your mouth there. You'll not be covering because you have to take off your face mask. And then you cannot also help when you're eating with other people. You tend to talk. And that time when I got COVID, me and my wife and three of those that were on the same table, five of us got COVID. And
Mm.
I'm the only one who did not land in the hospital. The other four land in the hospital. So that is something, the Filipino way. We always ask people, okay, want to join, eat with us, and then salo salo. That's gonna be a thing of the past anymore, and we have to be mindful. We have to take care of ourselves, and by taking care of ourselves, you're also taking care of our loved ones.
Okay, thank you so much, Councilor Joel Garganera. He is the czar for the Emergency Operations Center for COVID-19 here in Cebu City. Thank you so much for your time. Again, I'm Ryan Macasero for Rappler Talk.